Okay, we're all set. Wonderful. Good morning, everybody. For those of you who don't know me, I am State Representative Jamie Foster. I'm really excited to be here today with my fellow members of the Legislative Delegation, Rep. Dathan and Rep. Kennedy. And before I sort of dig into this, I just want to share that I spent some time last week at the White House Conference on Hunger, Health, and Nutrition, and I feel like there is a lot of momentum and energy behind the work that we're doing right now, and it is my single goal to sort of take maximum advantage of this great convening group that we have here, and the momentum and energy that the White House sort of deputized us with as the states to take action on this and make sure that we're leaning in and doing the best work that we possibly can. So I am so very excited to be here with all of you today. We have a packed agenda. We gave ourselves a little bit more time than we did last time. So I'm going to allow my legislative co-members to introduce themselves and sort of welcome you all, and then we'll get right to the work because there's so much for us to do here today. Rep. Dathan.
Thank you so much, Rep. Foster, and this is wonderful to see everybody here today. I too was in DC a couple weeks ago at a Medicaid conference, and there is a lot of momentum. I spoke to so many other legislators in other states, red and blue states, all that are very interested in this topic. So I'm pleased that we're doing this work, and I'm pleased, Jamie, for you taking the lead on this, and I'm pleased to have my other co-chair, Kathy Kennedy, here as well. So thank you.
Good morning. Can you hear me? Yes. Good morning, everyone. It's great to see everybody. I'm looking forward to getting into a lot of information today. And Rep. Foster, hearing about your trip to Washington and what you've learned, I'm very excited. This is it's a wonderful for me to be a part of this and to work collaboratively with my esteemed fellow legislators. So let's.
Thanks for being here. So we're going to go, we did introductions last time, but there are a couple of folks who are on the call today who haven't been on before. So if you are joining us for the very first time, would you take a minute to introduce yourself and share? And then some of the folks who are going to be on are on our agenda later on who are new, and so that you can feel free to pass that in. Though if you're new from an agency and haven't introduced yourself, please feel free to do that. And just bear in mind, if you're going to be talking later, you can make it brief. Is anyone new with us? Dan, go ahead.
Good morning, everyone. My name is Dan Giacomi. I work for the Connecticut Department of Social Services. I am the SNAP director for the state of Connecticut. Happy to be here.
I see Katina. Do you want to introduce yourself?
Yes, I'm Katina Gianteris. I'm from Wholesome Wave in Connecticut. I'm a programs and data manager. I'm interested in learning more. Thank you.
Heather?
Good morning. I'm Heather Ferguson Hull. I'm from OPM and the Health and Human Services Policy and Planning Division, and I'm here as part of the team with Zani.
Wonderful. Is there anyone else who wasn't here last week or last month? And Erica, we can let you introduce yourself later. Did I hear someone else?
Nope, that was me. Hi, everybody. My name is Dr. Kaylee Royson. I'm the legislative liaison here at the Department of Agriculture, and I'm joined by Jamie Smith, who will do a brief introduction. Go ahead.
I'm Jamie Smith. I'm the Bureau Director for Ag Development and Resource Conservation, where a number of our grant programs and our food benefit programs live in the agency. So nice to see you all.
Thanks so much for joining us, Jamie. All right, so I'm going to keep my update brief on the White House conference because all of the information is public and all of the live streams are available. But there are a couple of things that I sort of want to highlight from the policy document that I think we are uniquely suited to lean into as this task force that has convened. And so the first one is conversations about increasing the total amount of money that goes to a household when they are food insecure. And there's a couple of things that I want to flag that are outside of the scope of this group, but I think we should pay attention to. And so one, that's school meals, as we see whether or not those will be covered moving forward. We do not have FDE representation on this task force, but I sort of want to talk about make sure that that's on people's radars, that is something that was sort of outlined in Pillar 1, which is improving food access and affordability. What we will be talking about in this group is perhaps expanding the amount of healthy produce that is available to households that are food insecure. And so if you look under the White House National Strategy document under Pillar 1, one of the things that was outlined is expansion of SNAP. And I know Dan will talk a little bit about that later with the agency update. But we can also sort of make sure that we're talking about specifically funding for folks who have nutrition-related chronic diseases or who meet our criteria for sort of for food as medicine. And Erica is going to talk about Medicaid leavers that are allowable as an expert from Chilpy. And so we're going to sort of focus on that expanded financial resource. And another good mechanism for that is through the Department of Agriculture, because they already have a nutrition incentive program that aligns with SNAP and WIC and senior support. So we'll allow them to talk about that expanded access. Another thing that I don't think that we have time in our agenda today, that's an additional pillar, but as we talk about food as medicine, we need to talk about who is supporting people with healthy eating habits related. And this is also a Medicaid lever that needs to be looked at and invested. And we have representation here from CAND, and we have multiple dietitians on the call. And several of the conversations in person had these sort of intonations about how doctors don't have enough training on medical nutrition therapy. But there is another expert in the healthcare arena whose sole focus is providing medical nutrition support for people with nutrition-related chronic diseases. And that is a registered dietitian. We have licensure and credential. And so that's something that I think we should talk about. There was also a bill on that last year in the Human Services Committee that had a favorable public hearing, but wasn't voted out of committee. So I think I have emailed everyone. I responded all to our calendar event notification for the White House pillar. If there are things that we're not talking about, I just think that this is a great group for us to be having these conversations. And so I'd like to make sure that people take some time to look into that, to make sure that the things that we as a group are leaning into and putting focus on in the state makes sense, that we're not missing something else that's also low-hanging fruit for Connecticut to be a leader in and adopting policy that helps advance nutritional security and nutritional health in our community. And so I can give so many updates from the White House conference. It was really a wonderful experience to be there in person. I say this often when you go to academic conferences, that when you have a doctorate in something, you're like, I'm an expert at this one thing. And then you go to a conference and you're like, except for all of these people right here, right now. And so I always feel like I have so much passion for hunger and nutritional security, except for all of you in this room, that you all are also extremely passionate about advancing health and wellness. But at this conference, there are people who I've sort of admired from a distance for a really long time, all there rowing in the same direction. And that excitement, I'm hoping I can find ways to bring back to this group today and in the work that we're doing moving forward. And I'm hoping folks watch the sessions that are of interest to them in their agencies or careers, because there was a lot of really good momentum building, less so academic content, I think, more like momentum and sort of case studies, things that worked well in specific examples. So without taking too much additional time, I'd like to sort of direct us next to what's on the agenda, because I think these are a good opportunity for us to hear about things that are happening. And so I'd like to go, if it's okay, to first the agency overviews. And then what I'm going to do is I'm going to share the OLR research on other state models that was shared with me for people to read and digest. So is it okay if we go to the Department of Agriculture first? I didn't give Kaylee a heads up on that.
Oh, we're good. We don't mind.
Okay, great.
Just share my screen real quick. It's better. Can I just get a heads up or something that you guys can see my screen?
Yep, we got it.
Perfect.
We can see your notes and the slides in the side view if you want to change that, but I don't mind it. whatever is best
I
for
mean,
you.
I don't, you know, it's giving me trouble, so I'm just going to roll through it like this.
Great.
Just to save time. So, hi everybody. Again, my name is Kaylee Royston, and I'm the legislative liaison here at the department. I'm just going to do a quick overview of the Farmers Market Nutrition Program, and then Jamie's going to speak a little bit about the sort of strengths that we're seeing related to food as medicine and some of the issues or challenges that we've seen over the last couple of years. And then we'll take any questions. So for the Department of Agriculture, just a quick overview of our mission statement. Our mission is to foster a healthy economic, environmental, and social climate for agriculture by developing, promoting, and regulating agricultural businesses, protecting agricultural and aquaculture resources, enforcing laws pertaining to domestic animals, and promoting an understanding among the state citizens of the diversity of Connecticut agriculture, its cultural heritage, and its contribution to the state's economy. Our agency is pretty small, but broken down into 3 main bureaus and the commissioner's office. We have the Bureau of Agricultural Development and Resource Conservation, which Jamie is the director of. We've got our Bureau of Aquaculture and Laboratory, and then our Bureau of Regulatory Services. I'm gonna just quickly go over Jamie's bureau and some of the things that they do, but she did speak on that in her introduction. So it's up here. They do a lot of our emergency feeding programs, the Farmers Market Nutrition Program, our SNAP doubling, the local food purchase program, our Connecticut Grown Marketing campaign, most of our boards, councils, and commissions, including the Food Policy Council. They issue our weekly ag report, which if you're not already signed up for, you can do that on our website, and I really recommend that you do. And then our resource conservation does our farmland preservation and restoration and the Connecticut Farm Link, and then our newly established climate smart agricultural practices. And just tell me if I'm going too fast. I realize I speak very quickly. I have a history of that 3-minute testimony timeline, so I'm really good at getting all the information out really quickly. So the Farmers Market Nutrition Program serves participants of the Women, Infant, and Children's, the WIC program, and seniors over 60 who meet income eligibility guidelines by providing them coupons to purchase fresh fruits, vegetables, cut herbs, and honey at authorized locations throughout Connecticut. In the 2021 legislative session, that was expanded to include chicken eggs as a eligible food group. Sorry, there was a different word I was looking for. The WIC Farmers Market Nutrition Program is a congressionally authorized program administered by the Department of Agriculture and jointly funded by the state and by USDA. The program provides a coupon booklet to participants of WIC who are identified as nutritionally at risk, again, to buy fresh fruits, vegetables, and cut herbs at the FMNP authorized locations. The FMNP coupon booklets are distributed to local WIC agencies statewide by the agency through a partnership with the Department of Public Health. We have a full list of the eligible farmers markets and farm stands on our website as well. The Senior Farmers Market Nutrition Program is a supplemental food program for individuals over the age of 60 or those who are living in housing where congregate nutrition services are provided and they meet income eligibility. They have to be enrolled in another program with proper means testing, for example, renter's rebate, to verify their income, and each participant receives 1 coupon booklet annually. The FMNP, senior FMNP coupons can be redeemed at the same authorized locations throughout Connecticut, again, on our website. They're issued by the agency to municipal agents, elderly services nonprofits, or senior centers, and they do have a pretty high redemption rate. We are really happy with the way the Senior Farmers Market program is rolling out. So just a quick backstory in the last couple of years in our legislative session, in our legislative history. The Public Act 21-155, our act concerning agricultural enhancement, added chicken eggs as an eligible food item. It authorized the utilization of proxy redemption and removed the on-site signatory requirements. These were really big during COVID, as some of our nutritionally at-risk people or our elderly were really nervous about going out to farmers markets or farm stands during COVID and were able to use a proxy to go pick up those items. So they weren't losing those benefits when they didn't want to go out if they were elderly or had young children. The FMNP booklets were increased from $15 to not less than $20 during that legislative session as well. We did increase that allocation ahead of time, so we are putting more money out. And then for fiscal year 21 and 22 and 23, we received an additional $100,000 through ARPA funding for both the senior and the WIC programs, and that has been pushed out through the agency. Just some quick stats for 2022. We are in the middle of our redemption cycle, so we don't have full redemption numbers yet, but we have 101 certified Connecticut grown farmers markets that are authorized locations for redemption. We have 3 mobile markets that cover Hartford, New Britain, and New Haven. We have 15 certified farm stands where participants can also redeem their checks, and they serve 14 different municipalities. And the checks are distributed at 23 local WIC offices through our partnership with DPH, as well as 161 senior local coordinating agencies that cover 97 municipalities. So that is just a brief overview of what the Farmers Market Nutrition Program is and what it looks like and sort of the populations that we serve. I know that Jamie is going to have a couple of comments on the strengths of the program, and I'll let her take that over and then we'll answer any questions.
Good morning, everyone. Again, my name is Jamie Smith. I'm the Bureau Director for Ag Development and Resource Conservation. Our Farmers Market Nutrition Program and Senior Farmers Market Nutrition Program was one of the first established in the country. And as time has gone on, we've realized the need to not only continue the program, but diversify the program. The farmers markets that were around in the early 80s when the program was established were predominantly fruit and vegetables. That's what you can find at a farmer's market. And now we see you can get a whole array of food products at a farmer's market. And that was one of the motives for us to now add eggs as an eligible food, realizing the need for an affordable protein to be added to the program. That was how we settled on eggs. We've had a lot of requests to potentially add other eligible food items, but that was, we thought, a very manageable first step. So a diversity of food products continues to be something that we look to strive for in the program. Our state is one of the only states in the country that matches the federal allocation for this program. It actually goes far above and beyond. It's certainly not a one-to-one match. So that's truly a testament to the need for the program. And then as we've seen the legislature allocate additional ARPA funds to the program, that certainly reinforces the need. The program is an excellent first step for our new and beginning farmers to put their toe in the water, to experiencing farmers markets, to understanding the growing season and production, and it creates an additional market for when they attend a farmer's market. So we look at this as an additional currency, if you will. You have SNAP benefits, you have FMNP benefits, you have cash, and often there's municipal doubling programs that support both FMNP and SNAP at farmers markets. So, you know, it's been a really wonderful way for us to engage new farmers. We're also seeing a lot of farmers take advantage of the program that are growing in urban areas. Urban farming is, as many folks know, really rising in popularity and in need. So these markets are bringing not only an accessible food source into communities, whether it be urban, rural, suburban, or otherwise, but it's also creating a growing opportunity as well. So it's been a great program for us to identify for urban growers to say, hey, you're growing in this urban area, community garden, in your backyard, what have you. Did you know that there's a market in your town and we can work with you to get certified? When I think of some of the weaknesses, the administrative overhead is certainly a doozy for the farmer at times. I am very excited to say, and this doesn't really speak to improving the ease of the administrative overhead for our participating farmers, but we recently received an award from the USDA to transition the WIC Farmers Market Nutrition Program to an electronic benefit system. And I am so excited and so petrified all at the same time to move forward with this implementation. But I'm really hopeful that that will significantly improve the redemption numbers for our WIC participants. I do truly believe that because of the accessibility of SNAP and WIC food benefits, that it encourages WIC participants to utilize those benefits often before they're utilizing their FMNP benefits. And so I'm hoping that, they don't have to worry about making sure that they have a check booklet in their, bag before they head out to the market. It's all just living on their phone, that will really help improve redemption. So our senior participants are awesome about redeeming their checks. We really have encouraged and supported our farmers to not only attend their traditional market setting, but to do pop-up markets at senior sites and things like that to encourage and make the redemption of the benefits much more accessible than they might be otherwise for seniors with limited mobility, not necessarily physically, but don't have a car and things like that. So that's a quick touch on some of the strengths and weaknesses of the program. We continue to evaluate it. I'm very intrigued to see what redemption numbers look like this year as opposed to previous years, and very excited to use that as a baseline as we move forward to EFMNP. So thank you all.
Thank you so much, Jamie. Every time we're on a call together, I'm like, is it me or her?
That's a fair statement.
And Jamie's name is my maiden name, so I'm like I've been this is the first time it's been not in an email form, but in spoken form. I thank you both so much for your presentation today on this program. I find myself really excited about having both conversations about FMNP and SNAP on the table, because I think that those are great mechanisms, work that's already really effective and being done very well. I'll say, as a member of a farmers market board of directors for the Ellington Farmers Market, that we lean really heavily into our SNAP match program, and we really appreciate, we have farmers who do really significantly better revenue at markets that participate with the FMNP program. So good for farmers. And I hear from people redeeming all the time that there are things that they wouldn't get otherwise, that they feel like the quality is significantly better and improved. And I want to flag that before we move forward in other meetings, I do want to make sure that we have participant voices that are elevated to these conversations ahead of our meeting. And Witnesses to Hunger is a good place to get that sounding board. They have said that they'd be willing to participate and come and speak about some of the things that we've proposed and give their voices. And so the folks that are part of that organization are really wonderful and used to doing this advocacy work and participating in these programs. So we'll make sure that we have them come in. What I'm going to do, what I think makes the most sense programmatically for as we go through this agenda, is to, if anyone has questions specifically about the operation of the Department of Agriculture programs that they think will help them better understand, we'll go to questions specifically programmatically about FMNP that people think they need to understand. Then I think we can go through our other speakers, again, giving them time to talk about their expertise and agencies specifically. And then I think we should open up some conversation holistically about what we need next to build upon our understanding and where we need to go to leverage these models into something that looks like FMNP. So does anyone have any questions for the Department of Agriculture?
I do. This is Rafael.
Yep. Rafael, go ahead.
Yeah, so what I wanted to share is that the recommendations on the revisions to the week food packages from the National Academy of Medicine Committee in 2016, of which I was a part of, were never implemented by the Trump administration. And now I am here from Washington, DC, USDA office, that they are getting ready to now implement them. And I want to give you the heads up that those recommendations call for substantial increases in more benefits for fresh produce. So I don't know if Connecticut is already engaged preparing for this, but I think it is important for this topic for the state to be aware that this is happening.
Thank you so much for that. It's something that we've been actively speaking about here at the agency, but yes, it is. We are having conversations and preparing and hopeful for that increase.
And I will also say that DPH administers the WIC program, and they've been part of these conversations. And I'm not sure who the representative of DPH is today on the call, but we can make sure that when it comes time for them to be talking, that we make sure we have WIC voices really elevated in those conversations. I have a question about sort of our understanding about FMNP, and this could be a question that gets answered another time. If we decide that we want to lean into, as a leverage for food as medicine, expanding produce through the FMNP program, if we decide that's the lever that we want to pull or one of the levers we want to pull, do we have a good idea of who has access to the farmers markets versus wouldn't have access through transportation? Because I know if I think about like the lower Naugatuck Valley, for example, has a really high need, but there isn't, from my understanding, a farmer's market there. And I just wonder how many spots are challenging to reach because of farmer. And I know farm stands can be eligible for FMNP too. So I'm just sort of curious if that's been mapped and if that's something that we would have an option if we found out that there were sort of dead zones, like areas that were challenging to reach.
That's exactly how we're currently handling the situation. So right now, say we have a senior site that comes to us and says, you know, we heard wonderful things about this program. We would like to distribute the checks in our municipality. And we realize we don't have a farmer's market that currently exists. We will reach out to our certified farmers, for which there are about 300 of them, and identify one in the municipality that's looking to distribute, or in a surrounding town that's, you know, realistically nearby, and identify them as a certified farm stand where checks can be redeemed. We've also had distribution sites work with some farmers to say, please come to our senior site every Tuesday at 2 o'clock and do a pop-up farm stand so that folks can redeem their checks. So we're really happy to work with municipalities to help identify those farmers. Accessibility, transportation, I should say. Transportation is certainly a challenge, and that's where we've also tried to leverage mobile markets, but there aren't very many in the state. And as folks know, the overhead and the labor associated with managing a mobile market is certainly very extensive. So we haven't found a good, solid solution to transportation to a farmer's market. I know some of our markets are mindful of bus routes, train stations, fast track locations. We have had farmers do markets at fast track terminals. So I think there's some creative solutions that we're happy to work with, you know, identifying and finding, but that's generally how we've managed it in the past.
I really appreciate that answer. And it sounds like you're already doing the things that we might want to brainstorm or suggest. I guess my only follow-up question to that is, are there things, I imagine that there are senior centers that are doing transportation for folks anyways. Are there things that we should be thinking about as recommendations or standards that we can advise municipalities on as we roll this forward? And are there infrastructure that's needed for farmers to accept FMNP and SNAP that I know at some point in time there were grants, I think they were through DOAG, to have the EBT readers? Those are necessary. Is that something that still exists, or we should think about appropriating additionally as part of this strategy?
I would love to stick a pin in that question, actually, until after we get through this EFMNP round, because that's one, the infrastructure to accept is going to probably be one of our biggest hurdles when it comes to farmers accepting EFMNP. But currently, right now, so long as a farmer has a bank that accepts checks. I know Kaylee called them coupons earlier, but they really are a check. They deposit like a check. The farmers can accept them, right? They just need to be certified with us to be able to do that. With regard to accessibility and infrastructure, I think the South Central COG did the Access to Ag program, and I hope I'm not identifying the wrong COG, in partnership with RC&D down in southeastern Connecticut. They put into their commuter buses screens that identified the farmers markets. They created mapping and identified those those markets and farm stands along the bus routes that folks could stop at or utilize the bus lines to be able to go to those markets. I don't know the results of that. It makes me want to reach out to Jean Davies at RC&D and see how that's going. But I think that's a great example of how a COG could engage in improving accessibility to a farmer's market, right? The bus lines are already there. It's just a matter of elevating and highlighting what is along those bus lines and how folks could utilize them to improve their accessibility to farmers markets. So that might be something for us to noodle around and consider a little bit more, and how we can replicate it in other areas.
Yeah, and if that's something that they can share, like how they did it or what they did it, that would be emailed to the whole group, I think that would be wonderful.
It was funded by a USDA Rural Development Program.
Awesome. Those are really good grant programs. So great. Rep Dathan or Rep Kennedy or anyone else have anything to add to the Department of Agriculture before we move on?
This is super helpful. Do we have a copy of those slides?
Not yet, but I will absolutely email them to Cass.
Okay, thank you so much, Kaylee. That's great, thank you.
And I got a thumbs up from Rep Kennedy. Okay, anyone else? Without further ado, I feel like I'm going to now introduce who I feel like is another partner in crime in the anti-hunger space. Dan, I'm really grateful for you talking to us. I got the announcement of our SNAP increases while I was at the conference, and I did a little happy dance and scream. And so I'm sure there are a lot of folks who are going to be really, really, really grateful and happy for that increase. So thank you so much for taking some time to talk to us all about what we did, or you did.
Yeah. Absolutely, and thank you, and good morning, everyone. As I said earlier, my name is Dan Giacomi. I work for the Connecticut Department of Social Services as the SNAP director. In that position, I oversee SNAP policy for the state, and I work with our other divisions to help implement that policy through our field operations division and otherwise. I have a whole host of other programs that are also included, such as employment and training, nutrition education, outreach, et cetera. But today, I think what Representative Foster asked me to speak on really goes to the heart of SNAP policy and looking at SNAP policy in ways that we can maximize assistance for individuals. You may have seen the governor's announcement, but just to kind of recap, there were actually two things that went into effect on Saturday, October 1st. The first is just an annual cost of living adjustment. It happens every year at the beginning of the new federal fiscal year. They look at the cost of goods back in June and then adjust SNAP benefits based upon that come October 1. So because of the rising cost of groceries and inflation and everything else that was occurring in the summer period, we're seeing a larger than normal increase in the amount of SNAP benefits individuals in the state of Connecticut and nationwide are able to receive each month. When we looked at the numbers, I believe it was around 12.5, I think it was actually 12.46 increase in the maximum SNAP allotment for households in the United States. Tangibly speaking, what that means is I believe it's an extra $104 maximum for a household of four. It's a little bit less for a single household. I think it's around $30, $31 maximum. Why that is especially helpful, at least here in Connecticut as well, is we're still operating under public health emergency flexibilities that allows us to provide the maximum allotment to all households in Connecticut, at least for the next few months, depending on what happens with the state public health emergency in December, as well as the federal public health emergency in January. But for right now, at least, all households in Connecticut should see that increase in SNAP benefits to the maximum level for their household size. And if individuals do want to see what the benefit levels are, they can go to www.ct.gov/SNAP, and we have all of the changes there. So that is, as I said, a tremendous help to individuals to see around a 12% increase on average. But the other area I'm extremely excited about, and I think that's because that's not something that necessarily all states are doing, but it's something that we're able to do, and that it helps a group of individuals that perhaps are not always looked at when we're looking at help, and that is our working families, or those households that have a little bit of income but that do still experience the same struggles that many, including myself, experience with higher than average expenses, rent, mortgage, childcare, transportation, etc. What that is again, as I said, on Saturday, we increased the gross income limit for households to be able to receive SNAP benefits here in Connecticut. This is something that we've had the previous gross income limit, I believe, since 2009. So it's a long time coming that we did this, but something we're extremely excited about, as I said, because we believe that it's up to around 44,000 additional Connecticut residents that could now potentially be eligible for SNAP benefits that before were automatically denied if they tried to apply for those benefits because their income was above our previous gross income limit. Our previous gross income limit was 185% of the federal poverty level. As I said, that was something we did in 2009. And I'll go into a little bit about how we were able to do that, but just to kind of to level set why it was 185 before. When 2009, when we enacted that program, we tied that gross income limit to our Husky A for children income limit. That was something that was at 185 at the same time. As I'm sure many of you are aware, when the ACA took effect and we had the expanded Medicaid eligibility, that income limit increased. I believe it's now 201%, but the SNAP income limit did not increase in tangent with it. It was something that remained at 185%. Until this past Saturday. So a few months ago, I would say maybe around 6 to 8 months ago, the governor's office approached us and asked us to look at different programs or policies that we may be able to take and enact here in Connecticut that have kind of the biggest bang for the buck, but that aren't necessarily large scale expansions or that cost the state a significant amount of money to be able to do. The first thing that came to mind in our minds was obviously this increase. It's something that we're very, I don't want to say easily because I don't want to downplay the work that went into doing it, but it's not something that took a significant amount of effort or convincing to individuals to be able to enact this policy and increase it to 200%. The reason being is, as I said, there's a policy on the federal level called broad-based categorical eligibility. What that is something I believe around 30 or so states utilize right now, and it's something that the federal government allows states to utilize, which makes individuals deemed as categorically eligible if we provide for them another service that's funded through the federal TANF program. Here in Connecticut, we utilize a brochure that goes out to all of our clients called Help for People in Need, that identifies other programs throughout the state that are either DSS operated or affiliated, that then allows us to deem these individuals as categorically eligible. Right now, there are, I believe in the release it said 19 other states, but I've since found out that I believe Louisiana is also increasing as of October 1st. So that would make 20 other states here in Connecticut, here in the United States, as well as the District of Columbia, that take that policy and maximize it to the 200% that's allowed. Other states do increase a bit from the federal level, which is 130%. Some do like 160, 175, etc. But as I said, 20 other states and Connecticut and DC now go up to 200%. As I said, broad-based categorical eligibility, it's highly effective because there's three main things, at least in my mind, that it does. It helps working families by kind of smoothing out that benefits cliff a little bit. As their earnings start to increase, we don't automatically kick them off when they get to that federal level of 130% FPL. It allows us, as I said, to go up to 200. It lets some low-income households save for the future, because one of the other side effects of broad-based categorical eligibility that we're able to do is to remove the asset test for households. So it allows individuals to save up a little bit to be able to become self-sufficient. And it simplifies the SNAP administration. That's not necessarily directly a benefit to Connecticut residents, it is a benefit because the quicker and the more effective and efficient that we're able to process a case, the less likely an individual is going to fall off assistance or be improperly denied or be waiting to receive the assistance that they desperately may need at that time. So there's a multitude of different things there. And then separate from that, as you may have seen in the release as well, the receipt of SNAP benefits actually provides eligibility for other programs, whether it be federally, such as the WIC program, school meals for children, Head Start, and a number of others, but it also allows individuals to be categorically eligible, for state programs such as the Connecticut Energy Assistance Program. So just by allowing these 44,000 individuals to receive SNAP, we've now opened up the door to them going out and receiving other programs themselves or for their children. Some of the programs, such as the school meals, we have an automatic file that works between DSS and the Department of Education. So there's no secondary application that needs to happen. Once they begin receiving SNAP, that file automatically gets sent to the Department of Ed, who sends it to their school district wherever they may be residing and says this individual now qualifies for school meals. And it's something that's seamless. It's something we've been doing for many years, I believe at least 2011 in the school meals program itself, and something that then, as I said, automatically qualifies these individuals. So that's really, the crux of it. I don't have too much more to say about it. I'm and Representative Foster can tell you, I'm a person that once you ask me a question of something I may have overlooked or forgotten, I'll go off on a tangent and speak on that question for a good 10 to 20 minutes. So I do like to be able to interact rather than just speaking to individuals. So Rep. Datham, I see you have a question. I'd be happy to answer it as well as anybody else that has one.
Go ahead, Lucy.
Oh, thank you so much. Dan, this was great. I really appreciate you going into this. One of the things we've been talking about in appropriations is sort of single application system, so that somebody who maybe applies for SNAP also gets the information about the CT Energy program. I know you said about the school meals thing. How is that sort of system coming along so that folks are able to get registered? I guess one of my concern is really folks don't always know about some of these other benefits that might be eligible to them. So my hope is that, we have some sort of single application system, and then the system spits out and says, okay, you're able to get these sort of benefits, and, click here to get more information on each of those benefits and what it could mean to you. Really just to help folks. And then we can tie that into maybe DRS so that we can prove out income eligibility and other things like that. So how are we overall with that?
Certainly, that's a fantastic question, and it's something actually we're currently working on right now. And when I say we, I don't mean DSS specific, though we're a part of it. The Health and Human Service agencies are currently working on a program called MyCT, which does exactly that. MyCT, the first release of it, I believe, will be a pre-screener for individuals across health and human service programs. So you would answer a few questions on the MyCT website, and then it would do exactly as you're saying, Rep. Dathan. It would say, okay, based on the responses you provided, these are the programs that we believe you would be eligible for, which would include SNAP, Husky, or other Medicaid programs, energy assistance, WIC, things of that nature. So it's more than just the DSS programs. It includes OEC, it includes DPH, et cetera, that are all involved in it. From there, I believe the belief or the hope is that we would then be able to allow in the future release them to apply for these programs, and rather than needing to go to each agency, it would direct the application to the correct agency wherever they need to go, to be able to say, okay, I now want to apply for, these 3, 4, 5 programs, whatever it is I'm potentially eligible for. So I believe the plan, and please don't hold me to it because I'm not the lead on it, but I believe the plan is to get that out sometime within the next 4 to 6 months, I would say, if I'm correct about it. But that perhaps I think is something, a presentation on MyCT would be a fantastic agenda item for this group going forward so that they could see the work that's been done and what the plan is going forward. But that is something that Governor Lamont had asked Commissioner Gifford to get started on when she had her new title, and something that she's been working on since then.
Yeah, thank you so much. And I'm sitting here now thinking with my human services hat on, because we have the public health emergency ending. We are going to have to approach all of folks who are receiving Husky right now for redetermination. And, you know, my concern is 4 to 6 months could come right at that same time that we need to start doing this. And we don't want people to fall off. And we want people to be able to get everything that they're eligible for. So I do hope that we are good with that, sort of closer to 4 months rather than 6. And I'm going to kind of reach out to the agency who's managing that to see where we are. And in the interim, what are the agencies doing to ensure that people who enroll in SNAP are familiar with some of these other programs?
Certainly. So we have been doing a number of, I don't want to say events, but meetings and conversations with our partner agencies to be able to cross promote SNAP there, and as well as promote their program with our eligibility staff to make sure that when they're seeing an individual or talking to an individual, they're letting them know. So a few things that I can think of off the top of my head that you'll see come out is another separate program that we're doing, the pandemic EBT program. We're getting ready to administer what are called the child care PEBT benefits here in the next 2 weeks. Those will go out to all SNAP participants that were eligible in the time period, but that had a child under the age of 6. So that group is the same group that is potentially eligible for WIC and for Head Start. So what they'll receive when they receive those PEBT benefits is a letter letting them know that they're receiving these benefits as PEBT childcare benefits. But we'll also have a small paragraph, a few sentences that talk about the WIC program and where to go if they want to get more information or apply for that, as well as the Head Start program, the same thing, where to go and be able to apply for that. We also worked with DPH to create a flyer called Maximizing Your Benefits that lets individuals know the similarities between SNAP and WIC, as well as how they could utilize both of those benefits to maximize the amount of food that they're purchasing each month. The one thing that we like to talk about, as I believe my colleagues at DOAG spoke of earlier, is that with WIC and SNAP and the additional SNAP benefits that are coming out each month, it appears that the SNAP redemptions are remaining steady, if not getting higher. And there was a period of time where WIC redemptions were decreasing. Some of that is because individuals perhaps didn't understand that your WIC benefits do not carry over month to month. At the end of the month, whatever's left over gets taken back, and your SNAP benefits do carry over as long as you're utilizing them. So part of that flyer is to let people know, if you receive WIC and SNAP, you should be utilizing your WIC benefits first. Utilize those. That helps maximize, because now you're able to purchase the foods that, thank you, Heather, you're able to purchase the foods that are WIC approved and WIC appropriate and get those foods, and then still have your SNAP benefits to purchase more items there. We also had our friends from WIC come to what we call a internal quarterly SNAP operations meeting, where we get together folks from all of our regional offices to hear any changes, updates, et cetera, in the SNAP program. So what we focused on for that meeting was a presentation of WIC, what WIC is, how people can apply for WIC, where the WIC agencies are, again, to make sure we're cross-promoting in whichever forum the individual comes through, to be able to know about these other programs until we can get that kind of centralized MyCT up in place. Just to kind of touch on that a little bit, we do share your concern about the PHE wind down, as well as the intro of MyCT. So it's something that we have been actively discussing with them, and we'll continue to make sure that we're kind of running parallel tracks and they're not going to necessarily run into each other and have a situation where they're coming out at the same time or occurring at the same time.
Excellent news. And I'm sorry, Rep. Foster, for kind of going down that route with Dan, but I wanted to ask the question while we were here, because all of these things are so intertwined. And I think that having my covered CT, or sorry, my CT is going to make a huge difference for programs like Food is Medicine going forward as well. So thank you, Dan, again, for your explanations. Really appreciate it.
Thank you. I'm going to flag that Heather shared in the chat, but we're going to make sure all the resources we're mentioning go out to the whole group after as we go. Thank you for sharing the resource that as it was discussed. I have two questions, and then I'll let Rep. Kennedy and anyone else sort of ask mechanistically about DSS. But I just want to say something that I'm not sure. I think that sometimes when we promote a program like SNAP and we're talking about food as medicine, people might think, is SNAP necessarily promoting healthy food, and not know necessarily the differences between SNAP and WIC. And so WIC as a program, SNAP was designed to address hunger as a program, and it is a fantastic program, and the evidence is pretty clear that it flexes and expands and supports families when their income decreases. It's there to catch them as a very effective safety net to address food insecurity. The WIC program was designed to address nutritional insecurities, and therefore it's specific foods related to the most common deficiencies that we're seeing population-based over time. It has increased to be more related to preventing nutrition-related chronic diseases affiliated with childhood obesity and increased allotment for fruits and vegetables. So it's a highly effective program to address nutritional insecurity. There is a lot of conversation about SNAP in the mainstream news media that might make it seem like SNAP is not a program that promotes health and wellness. But what we know is that SNAP eligible households, those who meet the income thresholds for SNAP, have significantly lower diet quality than their higher income counterparts. But those who are SNAP eligible and participate in SNAP have significantly better nutrition outcomes than those who are eligible but do not. And so it effectively addresses the income predictors of diet quality that are affecting low-income households. And then Sally Mancini is on today, but Dr. Andreyeva from the Red Center for Food Policy and Obesity has a really good, robustly analyzed meta-analysis on the impacts of SNAP on diet quality. And so perhaps we can get that. She has like a 2-pager and the actual peer-reviewed publication that we can share. But SNAP works. There's like a bunch of at addressing nutrition-related chronic diseases. The science on SNAP is not as conflicted as some people might believe from public conversations around the program. It is a highly effective program at addressing food insecurity and diet quality related to income. And so I think as a dietitian with a PhD in nutrition, not as a state rep, I like programs that address nutrition insecurity that consider SNAP and not SNAP restricted plus something. I think that that's the most effective way, and I think the science is pretty consistent with that data across the board, that having SNAP and versus restricted SNAP are effective at addressing nutrition-related chronic diseases. So does anyone have any questions for Dan? Rep. Kennedy, do you have questions?
Hi, thanks. I apologize for my audio issues earlier, but Dan, I just want to thank you, and thank you, Rep. Foster. Dan, you answered most of my questions through the questions that Rep. Datham answered, but I just do want to really thank you for continuing to work with our school districts with the SNAP benefits. It's truly having that communication is so very important. So I just want to thank you for that. And I just want to hear from our other speakers today. So thank you.
Thanks so much, Dan. Does anyone have any questions mechanistically from a DSS standpoint and SNAP that we should flag with Dan before we move on? Dan, it's always a pleasure. Thank you so much for joining us on this. I am going to now introduce Erica. So the first item on our agenda was an OLR report on the overview of other state models. And the very first thing out the gate in the OLR report is the Chilpy 2-pager. So our Office of Legislative Research deferred quickly to the center at Harvard that does food policy and that has sort of an expertise on this. So I had the pleasure of being on a panel with Erica in Washington, D.C. this last week and talk a little bit about trying to ensure that the variety of state options that are available or policy levers for addressing food as medicine are elevated. This specific terminology for food as medicine really focuses on increasing fruits and vegetables that are available to families who might be eligible. So these levers really talk about what might be, I'm using the USDA's GUSNIP grant sort of terms, either the nutrition incentive or the produce prescription. So it's about getting more fruits and vegetables to families in need. And before I sort of switch to Erica to explain the policy lever and the document that they have, I'd want to point out that increasing a household's share of fruits and vegetables is a really effective way to improve the overall diet quality of a household. That this is a mechanism that is also an emerging science about the best way to make sure that those vouchers work, but they do improve nutritional security. It seems diet quality, and now there's a growing amount of evidence that shows that markers of nutrition-related chronic diseases are also improving when people have access to more fruits and vegetables as a household. So the amount that matters is not clearly defined in the science yet. How much it should be adjusted for household size, not clear in the science yet, but that increasing a household share to fruits and vegetables improves diet quality, food security, and pretty consistently now we're seeing a growing number of studies that also look at nutrition disease outcomes like hemoglobin A1C. Those are improving with these benefits. So Erica's going to share a little bit about the resource that they put together. We'll also email this all to you afterwards, but Erica is going to, I'd love for you to explain your expertise too, if you'd like to. So thanks so much for being here, Erica.
Well, thank you all so much for having me. I really appreciate it. Like Rep. Foster said, I'm from the Center for Health Law and Policy Innovation at Harvard Law School. That is a really long name, so we shorten it to CHILPI, which is also kind of awkward, so I apologize. But I am an attorney and a clinical instructor at CHILPI, and we advocate for the legal, regulatory, and policy reforms in health and food systems with a real focus on the health, public health, and food needs of marginalized individuals. And my work specifically focuses on integrating the social determinants of health into our healthcare systems. And here we're here to talk about, specifically food as medicine interventions. So Rep. Foster mentioned a specific resource that we put together for our panel that I was on last week. Was it just last week? I can't keep the week straight with all this travel. That was focusing on produce prescriptions. So really increasing, like Rep. Foster said, fresh produce and fruits and vegetables for families, really through Medicaid, Medicare, right, our existing federal programs and state programs. But here at CHILPI and in my program, we really focus all along the spectrum of food as medicine interventions and how can we pay for those and integrate those into our healthcare system. So I want to share, and I don't know if this was shared with you, another resource that we have that I think is relevant too, and I'll put it in the chat. A lot of what you all were just talking about, this is our research action plan, and I want to direct you to, when you get to dig into this, it's a really long document, but kind of halfway through, there's this foundational research section that goes to a lot of what you all were just talking about with SNAP. And it's a great overview of just like published peer-reviewed research on both the federal funded food support programs, so like SNAP and school lunch, our older American nutrition programs, as well as all of the food as medicine intervention. So like medically tailored meals, medically tailored groceries, and produce prescriptions. And I just think these charts are a really great resource in terms of if you're ever looking for research, right, to support the outcomes of these interventions in terms of like what Rep. Foster was talking about, how SNAP isn't just about like access to any old food. It really is about changing outcomes. So I think, one of my goals is to kind of condense these findings into something maybe like a 2-pager. But for now, I wanted to give you this resource as you all are digging into all of this, as something that could be really useful. So like I said, we work across all of the interventions, but the 2-pager that if you don't have it already, is focused on produce prescriptions, but it's also focused on how do we pay for this, right? Through Medicaid as a state. So as you all are looking to expand the use of food as medicine interventions in Connecticut, one of the ways that you can pull down a lot of federal funds is through Medicaid. And in the national strategy that the White House just put out, one of the strategies that they're really pushing is using their federal authority through waivers, right? Medicaid waivers. So that's something that we can kind of examine here. And one caveat that I want to say is I've been asked to kind of pinch hit in this meeting. So I didn't get to dive in as deeply into Connecticut specifically and your Medicaid programs, but I'm really happy to do that and examine, as you all are going through this process, kind of your specific approach in Medicaid, and work with you all if you have specific questions of how it would work in your state, and kind of develop like what that legal and regulatory process would look like, kind of in a more tailored way, and act as a resource for you all. So I know we have like only a little bit of time, but if I could, I just have like a quick PowerPoint, because I find this is like really complicated. And so to kind of break it down a little bit about what the Medicaid payment pathways look like, and options for you all. So if I can just share my screen quickly for you all, I will do that. Now we can't find you. Okay, can you see my screen? Okay, great. Okay, so kind of overall, an important thing to keep in mind when you're trying to pay for these interventions through Medicaid is that it's not a covered benefit. So it's not something like cancer treatment in Medicaid. It's not going through the front door of our healthcare system, right? That would just be like very easy in terms of getting your federal matching funds back. But they are getting through the windows, right? There are ways to cover it in terms of waivers and different flexibilities within the healthcare system. So what are those windows, right? There's many different options here in terms of, we'll go from like most comprehensive to kind of least comprehensive. So in terms of waivers, we have 1115 demonstration waivers, home and community-based service waivers, and then we have managed care. And I understand that Connecticut doesn't have managed care, so you're a little bit more limited in terms of like how to cover food as medicine interventions in Connecticut. But I do understand that you have kind of some creative options within Medicaid. Like, I think that Connecticut is still experimenting with value-based payment, right? And the way that the state contracts for services. So some of these options are not available to you, like in lieu of services and value-added services, which under the law are only available for managed care contracts. But some things like value-based payment, the state can leverage your contracting ability to cover things like food as medicine. And then there's state pilots through legislation, appropriation. You as the state can pull from different buckets, which I understand you've already done in terms of like taking GusNIP money to cover this. And you can pull from various different buckets. You can combine GusNIP money. You can combine 1115 money. You can combine various different money, home and community-based service waivers, which allows you to cover populations that would typically need institutional care or close to institutional care, and say, we want to help these people live at home in the community. And one of the ways to do that is to provide them with medically tailored meals, or provide them with produce prescriptions, or with nutrition counseling, or with any combination of the two. And we need federal Medicaid funds to do that, right? And so you can do that through state legislation. So although these things are kind of arranged in a tree like this, they can overlap, right? And a great way to do that is through your state legislative power, right? And to make that all make sense. But a lot of this, all of this can also be done through regulatory power as well. So it gets kind of confusing, but there's lots of states that have done it in various different ways. Like Massachusetts has an 1115 waiver, for example. North Carolina has an 1115 waiver. State pilots, California has done a really interesting state pilot. Same with Oregon has done a state pilot that's mixed with an 1115 waiver. So you can see that states are experimenting kind of all over the place because this is not a covered benefit. And then the last thing that I want to highlight is that there's a lot of coordination that goes into this, right? And I think that this working group is exactly what you need to make this happen, just having everyone at the table. So to make kind of any of these payment pathways occur, you need to have usually the legislature, the state Medicaid agency, and CMS kind of all working in conjunction. Here you'll see where it says state managed care plans in Connecticut, because you don't have that. That would be the state Medicaid agency. And then in the end, right, the big highlight is that you need to have enrollees, right, Medicaid beneficiaries, then uptake for the food is medicine intervention. So being really thoughtful, and I think Rep. Foster mentioned that at the beginning, that there needs to be kind of participation from the people on the ground. So being thoughtful about how are we going to get the word out there about these new benefits, and so that people understand. I think that was mentioned too in SNAP, right, with all these new programs, and make it easy to enroll and get people involved as you're developing these great new programs. Because if we go back to the research, they help a lot of people, but they can't help people if people don't know that they're out there and they're being taken advantage of. So that 2-pager will be shared with you if it hasn't been already. Like I said, though, that is focused on produce prescriptions, but it is widely applicable to the other food is medicine interventions. And as well, it is not tailored to Connecticut, so it has those kind of managed care levers on there. But I am more than happy to kind of dive in, answer your specific questions as you all are getting going in this task force and in this process, and you know, tailor it more towards your needs. So if you all have any kind of specific questions for me, I'm happy to answer them.
Thanks so much for being with us today, Erica. Before I open things to questions for folks holistically, I would love to see, does DSS have any comments or thoughts on, I know David's on how this relates, like this presentation, these options might relate to things that DSS has considered related to food as medicine. And I don't know if they might need a moment to get together. He's not on camera right now, but that's sort of the question that I have, is how close are these options that have presented to things that DSS has done? I don't know if there's who the best person from DSS might be to answer that question. So I'll frame that, and then if there is, are you ready? Do you, David?
Rep. Foster, you know, I don't know the answer to that, but I'm happy to take that back and sort of pose that to some of our folks and see if they have a response that perhaps we could provide at the next meeting.
Okay, that would be wonderful. I'd appreciate that. And perhaps that could be the agenda item for DSS next, is to sort of say the Medicaid sort of perspective, to talk about that specifically. All right, Lucy or Kathy, do either of you have questions here?
It was super informative. Thank you so much. I really appreciate Erica, the presentation, and thank you for joining on the road. I know it's hard to do this when you're in a hotel room, so thank you.
Thank you
You're
so
very
much.
welcome. And I see your comment in the chat, Rep Datham. Yeah, it's definitely, the 1115 waiver process can be long. I think it's helpful for food as medicine now that other states have done this, and that the Biden administration is so motivated. This was their top priority. So their top priority was supporting the legislation and Medicare Advantage. They're kind of limited, right, in what they can do to push that. And their top priority in Medicaid was supporting 1115 demonstrations. So hopefully that means they'll be a little bit more motivated, but that definitely is something to keep in mind, that these are big projects, and they do take longer, but it's nice now that there's more blueprints, and that the Biden administration is supportive, and we're definitely here as a resource to help. And David, if you want to talk too, we're here, and I'm happy to. I can put my email in the chat for anyone to reach me directly. I think at the end of that PowerPoint, it was just like our general contact, so I'm happy to put my personal email in there.
Thank you so much for joining us today, Erica. So we have a little bit of time, a small amount, a little bit left on the agenda. And so with this, I'd love to open things up to everybody, to the bigger group as a whole. I think that we have sort of an idea that there might be a lever in the Department of Agriculture to get more produce to folks in need. There are levers through DSS, both considering SNAP and Medicaid. And I think that with that sort of out there, I'd love to hear from folks about what they want to make sure that Connecticut considers as we do this moving forward. So are there other agencies that we haven't included in this conversation today who'd like to talk? Is there an OHS perspective that we should include? And then academic perspectives and partners, are there things that we should be considering? Or other institutions like healthcare organizations, are there things that we should be considering? Brent? Go ahead, Brent. Yeah.
Perfect. Thank you so much. For those of you who don't know me, my name is Brent Miller. I work in the Health Innovation Department at the Connecticut Office of Health Strategy. So I love these presentations. These have been wonderful, Erica, to hear you talk about the social determinants of health and how you're weaving them in, to hear what the Department of Agriculture is doing, the Department of Social Services. One of the things at OHS we've been really focused on are those social determinants of health. Right? And how do we tackle those? Because typically those are very upstream, right? What are the causes to those? And a lot of our interventions are downstream, and people are already seeing, a reduction in their health. We're seeing the cost go up. So how can we get at those upstream causes? So when we're thinking about these different programs, one of the things that comes to mind is like culturally appropriate food, right? So when we're working with farmers, how do we make sure that the food is, culturally right? That's what people want. And that goes with like our RFPs as well. How are we making sure, if we're doing a grant kind of project, that we're getting people from those communities? There's a few of you I've spoken to in past and done some work with, and I think we spoke with Massachusetts. And they did a whole thing on their RFPs to make sure that we were targeting communities, and I think you said this, Rep. Foster, that are not being addressed right now. So how do we make sure that we're getting people who are from those communities and know what those communities need? So I think that's one big piece. The other big piece, and you mentioned this as well, is like with nutrition and hunger, we've been very focused on the nutrition side of the equation, right? Making sure that people, our interventions are addressing what is causing poor health. So there's a variety of foods out there, processed foods, right? For everyone who's ever watched, I think it was the Disney movie Soul, they have a great quote on processed foods, right? So how do we make sure when we do these programs, when we use these levers, that we're really using our ability to incentivize good, culturally appropriate foods? And the other thing that I have on my mind is when we're doing all of this, and when we've been talking with the various communities that we have through our Health Enhancement Communities Initiative that started kind of way back in the state innovation model days, is how we fund these. And social determinants of health are everywhere, right? And thinking about a paradigm shift of unrestricted funds, right? When we close the scope and we only focus on one piece, we might be tackling just the taking care of food insecurity. But also, I think you mentioned this, Rep. Foster, transportation, education, housing, employment. All of these issues are going to be impacted. So when we work with our communities, thinking about a paradigm shift of going more upstream, of thinking about creating items that are more unrestricted. I know I heard, I think it was administrative burden being a weakness. We definitely hear that with our communities as well. A lot of the grassroots organizations that are really great at kind of being trusted messengers that are active in their communities, they're on a shoestring budget. And it is really hard for them to meet a lot of the administrative burden that comes with our different programs. So how can we accommodate them and make sure that when we work with them, we're also thinking about those other pieces of, why do we have poor health? It's so food absolutely is one of them. But then, like you said, Rep. Foster, just to kind of highlight that, but if you can't get to the food, right? Or if you don't have a job, or if you're just missing that benefit, you're in that gap, right? So all those things I think are definitely areas that we've been focused on, and I'm happy to go in what we're trying to do with our health enhancement communities at another time. I know we're short on time, and I'm just talking, but this is really wonderful, and I'm very excited about it.
Thank you so much for joining us today. Are there any perspectives from anyone else that we'd like to sort of make sure that we have perspectives being elevated and included? I mentioned earlier today that something that was consistently spoken about at the White House conference was in connecting people to nutrition education. And so I want to sort of flag that DSS has some cognizance and DPH over SNAP education. So that's the nutrition education for people who are getting nutrition assistance, but there are other resources available to families, but not all of them are accessible. And so if it's okay, I was going to ask Heather if she had something to say. Lucy, is that okay if I go to her as the flow of the conversation? Okay, great. So I'm going to ask Heather to sort of talk about like a registered dietitian model, but I also want to flag one of the things that Erica mentioned is sort of medically tailored meals and medically tailored groceries. And I don't want to lose sight of that in our conversations if there are ways that we can include those specific interventions in what we're doing. I published like about a year ago now about children who face food allergies in the school system and the policies that are supportive of them in their school meals. And we address that in our school nutrition program. But practically speaking, allergen-specific foods are really expensive when you compare them to other groups. So families who face food allergies actually have significantly higher rates of food insecurity and higher incomes than those without. And that is true for, in general, accessing medically appropriate foods for diets that are restricted. So if you have kidney disease, or specific allergies, or particularly true, we saw this in the formula shortage, and nutrition mismanagement of a specific amino acid that your body couldn't process. Those like specifically medically appropriate foods and supplements are really expensive and not consistently accessible to families in need. And so those are things I just want to sort of flag and put out there. But Heather, how should we sort of be thinking about getting nutrition education to folks when it comes to food as medicine?
Sure. Thank you so much. This was wonderful, and it was fantastic watching the conference last week. I'm really glad you were there, Representative Foster. So I'm here representing the Connecticut Academy of Nutrition and Dietetics, and I would say just to remember that here in Connecticut, we're really lucky. We have about 2,000 registered dietitian nutritionists. We're considered a medium-sized state, even though we're a small state. And so there's a lot of different ways. One is through medical nutrition therapy. There are dietitians across Connecticut working with Medicaid clients day-to-day, doing nutrition education around diabetes, hypertension, various chronic diseases, and they have a bit more time with the patient. So I think that's something that's important to keep in mind. On average, a medical professional might only have 5 to 7 minutes, but a dietitian will have 30 minutes or more. So they have a bit more time, not only to talk with the patient about their medications and their prescription, but like Jamie was saying, with really specifically how they might include that food or that fruit or vegetable, cooking it, preparing it, storing it. It's not just buying it, it's also eating it. And that's really where the nutrition comes in. So I think medical nutrition therapy is extremely important, as well as those nutrition education programs that exist. So SNAP-Ed, which is the Supplemental Nutrition Assistance Program Education, there's nutrition educators across the state. There's another federal program called FNAP, Expanded Food and Nutrition Education Program. These are nutrition educators across the state working with the clients we've been talking about all day and really connecting them to those resources. So it was really exciting to hear Dan talk about that increase in SNAP. That's going to make a big difference. And as soon as that came out, I blasted to all the partners I have. And I think that is a quick summary, but I could talk a lot more if we want that at a future meeting.
We might want to consider making sure that we are, in sort of the categorical eligibility, making sure that we've elevated the option for FNAP and SNAP-Ed as part of what we're talking about. And that's not something we need to, from a policy standpoint, have a lever for, but we can try and make sure that we're doing something to elevate those opportunities. Rep. Dathan.
Thank you so much. And thank you, Heather, for those comments. It was really, really valuable, what you're talking about. And I was thinking about something that Brett said about really looking at the social determinants of health and looking more sort of upstream in what we can do, and thinking how we can get involved, the Department of Education. I think not only just looking at the school lunches aspect, but really the education of our young people. I know I have 3 kids, and my oldest one, when he started learning a little bit more about health and nutrition in high school, he was like, oh, it was like a penny dropped. And I'm just kind of curious, if we are looking at this, particularly in areas that have, are more disadvantaged, what can we do on an educational standpoint to ensure that our young people understand that food is medicine and that should be an integral part of the program? And likewise, just kind of thinking about the school-based lunches. I know anecdotally, I've heard, they're not always the most healthy. And really, how are we ensuring that the State Department of Education is kind of thinking that through a little bit more upstream rather than necessarily downstream? So just a couple comments and some thoughts. Thanks.
I'd love to ask, is there anyone from our healthcare organizations that wants to sort of talk about how this might make a difference in there? I'm looking, we've lost quite a few people. I don't see any of the healthcare providers we had on originally. Is there anyone else that would like to share a couple of things and any thoughts or ideas of what we need next moving forward?
I can speak to healthcare
Oh,
providers.
good. I'm sorry, Nancy. I didn't see you were still on.
No, that's
Thanks for being
okay.
here.
I know I'm hidden in a sea of names without faces, but yeah, I mean, I do think that there is a little bit more focus on social determinants. I know at least at Connecticut Children's, our IT people are working on incorporating it into EPIC, and we are trying to kind of roll it out into primary care. You know, we have a really small grant program of a produce prescription program that we've been giving out a fair number of prescriptions, but our redemption rate has been really horrible, mostly because we're working with Hartford Food System, and they're limited. Their mobile market is limited in terms of how much time and manpower they have to come and be, you know, outside of our facilities. But so Hartford Hospital now has just opened their, you know, food pantry in the hospital. And I do think that there does need to be more of a push and connection for medical providers, especially primary care providers. And we are definitely trying to do this in pediatrics and with the clinically integrated network at Connecticut Children's for healthcare providers to actually understand the importance of nutrition, and also to really encourage patients who are eligible to enroll in WIC and SNAP, because it is amazing if you look at the statistics. I mean, I think in the first year it's a little bit higher, but I think, you know, for 4-year-olds or 5-year-olds, it's, you know, 25% or something of eligible kids are actually enrolled. So I do think that, you know, there needs to be among practitioners and healthcare providers just more of an awareness and more of, you know, just including it in our histories and in our, you know, ancestor guidance in terms of, you know, because if we have kids who are in Husky, they are eligible. So just, you know, helping them to understand, you know, that they can enroll and that it would be to their benefit to enroll. But I think as people say, I think Lucy, maybe you said in the beginning that just the enrollment process for, you know, having a streamlined enrollment, I think would make a big difference. And I was at a conference, the Let's Go 5-0 conference up in Maine, and they were really focused on disparities. And that was one of the big things that came out of that conference, all of the speakers, is that, you know, streamlined enrollment into housing, into, you know, nutrition programs, into, you know, electricity or gas help, you know, all of that utilities programs would be helpful, and I think would help more people be enrolled. And I'm going to stop talking also because I'm kind of losing my voice.
Thanks, Dr. Trout, for sharing that. So I want to sort of mention, there is also like an increased amount of pressure and attention on maternal and infant mortality outcomes. And some of the social determinants of health that are specifically related to outcomes are things that are associated with nutrition-related chronic disease, but we're also noticing that nutrition outcomes don't consistently have the same benefit maximally achieved when we are leveraging them. And I think this is me saying, this is my interpretation, not my expertise, but I think that that's because we are not considering access as we are enrolling folks in programs that they might be eligible for a program, but we're not making sure we're meeting folks where we are. And so they're not getting the maximum benefit that they could get. I'm cognizant that we are up on time. And so what I want to sort of say before I move on, it's really my goal that by January that we have a legislative policy proposal that we feel like the agencies and academic and healthcare institution partners are bought into what we are proposing, that when we introduce this bill package, that Rep. Kennedy and Rep. Dathan and I, that we're taking recommendations from this working group and we're introducing a bill that people feel like is a product of all of our collective thoughts. So we're going to schedule the next meeting, move on to the next agencies as they have thoughts. But as folks think this is something that's important from our agency's perspective, or this is something that's important from our expertise perspective to be considered in that legislative proposal, I want to make sure that you feel like during these meetings that you have a time. So if you'd like to have an agenda item, if you could email me and copy Rep. Dathan and Rep. Kennedy and Kath, and Jeannie Phillips is going to be taking over some of the clerk perspective roles in this moving forward as Kath's responsibilities are shifting at this time of year. It would be really helpful for me if you have something you need to share that you feel like the group needs to be bought in on, that you let me know and we give you time to speak during these meetings so we can get that carried on. And I am grateful to you all for sharing your expertise, and sorry for keeping you 2 minutes over, but thank you so much for being a part of this conversation.